Hello and welcome to the Purves Versus podcast. My name is Eric Purves. I'm an RMT course creator, continuing education provider, and advocate for evidence-based massage therapy. For those of you who've been listening for a while, you probably noticed I changed my intro music. This is because I started uploading my podcast to YouTube. And although the music I used was open access, there was the potential for some copyright concerns if enough people actually started watching and listening. So I decided to be safe and changed it up. You can check me out on YouTube by searching Purves Versus, Purves Versus. So we decided to do things a little differently with the YouTube format though. My wonderful assistant Kate has added some visuals and summaries of key discussion points, so it's not just two talking heads for an hour. Please give it a like and subscribe so you can be notified of all future episodes, and let me know what you think. In today's episode, we welcome Christian Lacsamana, who is a new RMT based in Vancouver, BC. Christian was previously a kinesiologist who decided he wanted to pursue a career in massage therapy so he could be more beneficial to his clients in addition to exercise and movement. Our conversation focuses on his experiences in school and what his first year of practice has been like. Christian shares what he enjoyed and what he felt could be improved upon in the curriculum, and he tells us about the future endeavors he wants to pursue as an RMT. Hey Christian, thanks for coming here today, for being on my podcast. I appreciate you taking the time to be here with me. I believe we connected probably about a year and a half ago through Instagram. I think you followed me or I followed you or something, and you were just finishing up your schooling. And I reached out to you to be on this episode because I was curious to hear about your experience as a RMT, a relatively new RMT. And so today we're going to discuss a little bit about your RMT experience and what the schooling was like. And then kind of just you can tell us a little bit more about your experience now being a new RMT and what it's like working. So thanks for being here today. Just tell us a little bit about Christian.
Thank you, Eric, for inviting me to the podcast. I really appreciate this. So my name is Christian Lacsamana. I am a new RMT. It's been a good year now, and I went to a public school in Vancouver. I really enjoyed my time there. Prior to studying massage therapy, I was a kinesiologist. I have a bachelor's degree with kinesiology, and I practiced a little bit with that, and realized somewhere in there that I wanted to do some form of manual therapy. And that's when I really looked at massage therapy. I did my due diligence to ask some newer RMTs, some RMTs that I've met over the years, working as a kin, that's been working for 10, 20 years just to get a sense. And I thought the program was fast paced. I thought there was a lot of stuff that I learned that I didn't think I would learn in the program. So such as classes like heavily on neurology and definitely pathology. Was there anything specific that you wanted to ask me, Eric, to just start this discussion?
No, just curious, just to get an idea about who you are and just because we've connected a little bit on Instagram. And then that's one thing I find is funny is seems like most of the new RMTs I connect with are on Instagram. Seems like the old RMTs have been around for a while are on Facebook, and the new generation I always seem to connect with on Instagram. So it's kind of a generational thing. You can tell how old somebody is by what social media.
Perhaps.
Yeah.
Perhaps.
I guess so. The one thing I was curious about too is you do see this a lot in massage. You see a lot of people that come from a kinesiology background. What was your experience like working as a kinesiologist?
So I've never registered with a BCAK. I've always worked in a recreational communal setting. So I was training people at VJH through the cardiac rehab program over there. I also did that in a recreational setting in Vancouver, doing one-on-one work with people with cardiac issues. I've also delved into helping people rehab post-joint replacement. And there was a lot of stuff that I was hearing from such clients that they were seeing a massage therapist, they were seeing a physio, and I thought perhaps becoming an RMT was a form of possibly bridging that gap. I wanted to do more than exercise therapy, and I was like, you know what? If I can only do learn some form of manual therapy in some way or another, perhaps I can be a better person, better clinician to these people. And that's really what um, started my journey into massage therapy.
Nice. Did you find that there was a like having that kines background? So you were very comfortable with like an exercise prescription and kind of getting people moving and stuff. And then the RMT. Did you find that like that combination? Do you feel that that's kind of a good foundation for your journey as being like a healthcare provider?
I can only speak from my experience, and I thought entering the school, I was used to fast-paced studying per se. There was a lot of courses, at least in the first year of the program, uh, for the RMT program, that I felt like, okay, I knew this, I know that, I have a pretty good sense on understanding things. That, but at the same time, like I sort of noticed in the second half of the program, there was a lot of things that was super specific to massage therapy that I was, I didn't quite learn much during my kinesiology schooling.
Right.
So yeah.
So what kind of things were specific? Like are you talking more like kind of the hands-on type modality stuff? Or what do you when you're saying not
Yeah,
specific?
hands-on stuff, and also learning a lot more about systemic conditions, pathology, contraindications, stuff like that. And then later on, just this is more uh, probably more during my first year as an RMT that I was like, okay, the soft skills was a little bit more important, and also seeing the person as a whole, not the condition.
Right. Yeah, and that's
So a
actually one
lot
thing.
of kind of the pain side stuff, right?
Yeah, yeah, and that's actually one thing
So
I wanted to discuss with you about that was, and you said that the soft skills, which is really important. And I always say it's the soft skills, but those are I think those are the hard skills anyway.
I agree. I agree.
Yeah, and so in your program, did you guys learn much about like treating like the whole person or focusing on the individual, or is it still a lot of it like you're focusing on a tissue or a body part?
Um, from what I remember, it was it was mostly the latter. It was still learning a condition, treating a specific area of the body. Although I will say, as the program progressed, it was there was a turning point where some of the instructors at the school that I went to in Vancouver was they really kind of wanted us to hone and understand that it was more than the condition. It was more than the injury. It was you know the whole person and what's going on with them, right? The term that we like to use nowadays is the biopsychosocial model. That was introduced early on in the first half of the program, and I felt like it was almost at the end of the program they kind of brought that back. We've learned so much about massage therapy, all of the conditions, whether it's systemic, orthopedic, a little bit of both, all these modalities that we've learned, all these techniques. But I found that the school where I went, there was a few instructors that really highlighted that, you know what, go back to some of the notions that you've learned in term one, and now you can really understand why those apply when, moving forward, becoming an RMT in the real world, right?
Yeah, that's great to hear though that you were introduced to that kind of terminology first term. In the courses I teach, one of the things I often ask people is like, who's familiar, who knows what biopsychosocial means, or who's familiar with the term. And I would say on average, and is probably 80 to 90% people don't really know what it means or have never been introduced to the term before. And these are people that
Mm.
have been practicing already. So it's really encouraging to hear that in your first half of your program, in the first year, you're already been like, yeah, here's something about thinking about the whole person, right? So thinking about not just the body part, but that zoom out approach, which is great. And you said that you had some instructors that came in and they kind of like brought that back. And that's one thing that I'm actually really curious about with the student experience is what was the consistency like among the faculty? Like, did you find that there was some inconsistent messages, or was the faculty kind of all kind of saying the same type of thing?
Hmm, that's a very good question. I can absolutely remember instances where there was a bit of a mixed message with certain stuff. So let's talk modality wise, right? Some of the manual therapy things and modality courses, right? Um, there was a lot of stuff that some of my instructors were by the book, right? You got to learn it this way. This is how it's done. We're basing it on our good old rat trade, right? And some of the books that we usually use for massage therapy school. But at the same time, there were also some of my instructors over the years that introduced us to techniques, but also kind of made us critically think, right? That some of these techniques are possibly might be based on old evidence and um, certain articles that was brought up during the school. There weren't many of them, but I was sort of glad that it was brought up to, to make us think, right? We're learning a certain modality based on a book. This is how it's done, right? We're learning how to apply it on our partner or possibly in the student clinic. And I have definitely met some instructors, whether it was in the clinic setting or in the classroom setting, that, kind of planted that seed that, you're learning these modalities, but at the same time, you know, let's go over this article, for instance, or let's also question what's going on here. So I would say there was a bit of a mixed message, but in a good way, if that makes sense.
Yeah.
Right? It creates thinking. It creates that seed in our brains to just be like, okay, like whatever I learned in school, especially when a technique or notion is based on a 20-year-old book, right? I'm like, okay, let's see what do we think about that, right? And then now that I'm an RMT, reaching out to you through social media and hearing your name. I heard your name and what you're about, even in school, from certain instructors. I was like, okay, like as a mature student coming into RMT school, right? Being a kinesiologist beforehand, I was all about that. I was like, I knew that the books were gonna say something, and the current evidence or what is really out there in the public is could be completely different, right?
Right. Yeah. That's
So
actually,
so I
that's
felt like, sorry, go ahead.
no, go ahead. No, go ahead, Christian.
Uh,
Sorry.
yeah. So sorry to cut you off there, but I felt like, this first year has been a rough road, right? It's been a rough road, and I think a lot of RMTs can realize that. But you know what? I'm all for it, right? Learning through the experience and learning from others through continuing education.
Yeah, sorry, I didn't mean to interrupt you there, Christian. That's it. You made some really great points there. I mean, and it's obviously it's nice to hear that I was mentioned hopefully in a positive way in the schools. I've been at this for a while, trying to educate and change things and stuff. So that's interesting to hear. And I know a bunch of the instructors at the college you went to. And we won't call it the college because we don't want to even though it sounds like it's good, even though it sounds like it's good press, we'll kind of keep it. You're not saying anything bad or throwing anyone under the bus, but just we'll keep it. We'll keep that one off the record. But yeah, the place you went does have a very good reputation, and some of the instructors there I know do the best they can. But the thing I was really kind of curious about it, and the kind of this little discussion here was about the mixed messaging, because I do know from talking to lots of students over the years that they'll get a couple instructors that will get them critically thinking. They'll introduce kind of some of these buzzwords we hear now, like pain science and biopsychosocial and evidence-based practice and person-centered care and all these terms. And they sometimes get introduced, but lots of times they just get said, and then the students don't really get a chance to really explore what that means or how to apply that critically or clinically to apply that information. And what I hear often is from people is the mixed messages can be frustrating or can be confusing. But it sounds like in your case, it was actually those mixed messages actually help to inspire you guys to think, or to help you anyway to think differently.
Right. No, I felt that way. Yeah, no, I think it's good to be accepted, especially in our field. But no, there was definitely, not many times, but I thought it was enough for me, at least, from my experience.
Yeah.
and I had a cohort where we asked a lot of questions. I was very glad, and I think that really brought up a lot of discussions with certain classes and moving forward. Some of us still kind of talk about certain stuff and what we're doing outside of school now or RMT. So, but yeah, that was my experience at that school.
Yeah, no, that sounds really great. That's really positive. And I know in BC, I think we have 9 or 10 schools now, and it would be nice. I would love it if like everybody's experience in school right now was what yours was like, and some of the other people I've met from your program over the years. Because it seems like that's such a small snippet of people, and then you hear people with these other programs where it's like it's outdated. It's very like pathoanatomical, very structural, very modality focused. And so it sounds like you guys are getting more of the best kind of one of the best available educations that you can, which is great, which is what we want. And that's what the public deserves. And that's what you guys deserve. It's hella
I
expensive to
agree.
go to school. It's hell of expensive to go to school. Yeah. So what about what was it like with some of the other students in your class? Like, I know you said you were a mature student. You already had a bachelor's of science degree. What did you find the mixed messaging was confusing or frustrating for others, or did everybody kind of accept it as like, oh, this is just the way it is? And
Based on just looking back now, right? I found that there was a couple of people in the cohort that was probably coming maybe from a non-science based degree. Not that it truly matters, but I think critical thinkers are just critical thinkers. But I found that the people that may have been struggling academically, so to speak, they were solely focused on learning the material, learning how to do things, and passing, right? And I mean, I'd be lying if I said I didn't see it that way too, in one aspect. But there were times where like, okay, like the program is indeed fast paced. I mean, it took me 2.5 years to do the program, and looking back at it now, there was a lot of stuff that we learned, right? But yeah, I found that there was a couple of people that was really focused on just passing, and more power to them. But at the same time, there was a few mature students that would always question everything that we were learning in school. And I thought it was kind of a good blend, right?
yeah,
It was a good blend, and whether or not what they wanted to do was just pass the program and then practice, or whether or not they actually wanted to meet certain people, whether it was the teachers, the clients at the student clinic, or their cohort colleagues, and literally bounce ideas, right? And that's what I found. There was a few people in my cohort at the college that I went to that was really into research, and there was one guy, and he was like, Christian, look at this article about what we're learning, right? And I was like, oh, that's so cool. So I thought that was really neat, like just getting to know people in the cohort, where everyone's mind is and what their focus was. But I thought, it was a good breathing ground per se, as far as like learning about massage therapy and other stuff, right?
yeah.
Pain science, kinesiology, and the overall field of rehab. So
That's great. So you mentioned you guys learned pain science, and okay, that's where my main area of interest is understanding pain, and as much as you can understand pain, it's such a thing, such a strange thing, and the more we learn, the more we don't know. But you guys did get a good dose of kind of pain science in your program, hey?
it was more of an introduction. I wouldn't say it was like we really truly delved in it, right? It was just certain classes where we discussed it and stuff like that. But as far as, oh, we're going over an article today about this type of topic about pain science, very little of that, to be honest with you. But it was really more of a introducing what it is and stuff like that.
Okay.
At least from what I remember,
Yeah,
which
yeah.
I thought was good enough. I thought it was good enough in retrospect. But at the end of the day, now that I'm an RMT now, and it's year one, I think we also have to be accountable to find, courses and other continuing ed that that we need to know, whether it's pain science or whatever it is that interests us, right?
Yeah. No, that's such a great point too, because the schools, their job and our regulatory college is there to basically give us entry to level practice, right? So teach you basically how to not be terrible. It's kind of like
Yeah,
how do you go
yeah.
in the public and not make people worse and provide the best level of care that you know. But it's such a great point you made though too, that we do need to continually learn. Like I've been practicing for over 16 years. Like I went to massage school. It started in 2003, so it's been a long time
Mm.
ago that I went to school. And I don't know if when I was in school maybe we were, and it was just so long ago I forget. But I don't ever remember being given like a lifelong learning plan. It was more kind of like you're going to learn everything you need to know in school, and then you're just going to go out and do it, and then you can take courses because you have to. That was kind of the way I remember feeling. And it wasn't until after I was
Mm.
practicing for a lot of years and starting to like notice there was gaps in my knowledge or things that I learned in school didn't seem to make sense anymore. It wasn't until then that I started to start ask questions. So I love to hear. It makes me so happy to hear that your experiences, you guys were given tools and ideas to kind of critically think and to be been like, yeah, this is the start of your journey, as a professional, and you're going to keep on learning. And I think that's such a powerful lesson. And I would love it if every single school or every single RMT I met that went to school had that same experience, because I think it would make a huge difference to what our profession, how we feel of ourselves as a profession, as well as how the public feels about us. And we know the public loves us, but we know, I think there's a lot of gaps in what we haven't realized our full potential, I think is what I'm trying to say.
Yeah, no, I have to agree with you on that. Um, yeah, there was actually one thing I wanted to add regarding, discussing the school that I went to and what the experience was like. Um, I also tutored throughout the program, being a student, and what I can say is, uh, still a good chunk of the program is about, like, I can see it in the students that I was tutoring back, a year or 2 years ago. It was all about passing, really. Most of the students was solely focused on passing, right? And I get it. It can be a heavy material for 2 years, right? But I have to agree with you. If I do choose to come back as some sort of a TA and clinic supervisor, I would love to be that instructor that I had at the college where I was, to plant the seed and get them thinking. Like, we learned the stuff in the books, we learned it in classes, but it's so much more than that. That's like you said. I met an RMT that's been practicing for 20 years lately, and this person said, what we learned in school is to just be safe, and it's
Yeah.
truly entry level practice. That's what it is, and I think the schools do a pretty decent job at that. But you know what? As an RMT who's been practicing for a good year now, there's so much more to cover, Eric.
It's really
in,
hard
an,
to
in,
do
an
it.
ex- in an exciting way, I would say, in an
Yeah.
exciting way.
Yeah.
Yeah.
Yeah. And that's such a great thing to hear too, because yeah, there's so much more. I mean, because in school we learn, yeah, like you said, like just entry level practice, don't cause harm. But sometimes I feel, and this is just my own feelings on this, is that because the program is so short, right? We like, and my bias would say like it should be like a university level program. It should be like 4 years where you can give a more rounded education, because sometimes, like you said, some people are there just to pass the board exams. They're only like focusing, they got the blinders on, so to speak, just focusing on what they need to learn to pass the board exams. And I understand that too, because when I went to school, there's a lot of us that were like that. I was probably like that too. So long ago, it's a little bit blurry, but you want to focus on passing the board exams. However, it would be so great if you had a little more time where you could try to put all this information together before you're kind of released to the public. Because what I felt, and other colleagues I've talked to over the years, is you feel like you go out and you're supposed to be safe, but because you don't know what you don't know, you end up saying and doing a lot of stupid shit, which probably, I shouldn't say probably, definitely probably made people feel worse. Or I said stupid things that made them feel broken or weak, or maybe taking, like, disempowering them because I was giving them some structural narrative, and I think that that is where I think some of the gaps lie, is that students, I think, need to leave the program knowing that you only know so much, but be very mindful of what you say and do, because you may have an impact on people that might be negative, might be positive, but let's go towards a negative bias here, where you might do something that might make the person feel worse, or you might do something that
Right.
makes them feel worse physically, or maybe like psychosocially, mentally, emotionally, because you said something that was taken the wrong way. That's it. That's, I think, where some of the information gaps are, that I would love to see anyone listening in schools. I would love to see them explore that, right? Just to make the program a little more in depth would be ideal. I know they're private schools, so it's a business, but I would love to see
Right.
that. I would love for the schools at least to recognize, and maybe the stakeholders to recognize, that our program is pretty good, but when you have a little bit of information without the right context and you release people out to the public, there is potential problems there if the student is not aware of the potential harm that they could cause.
Yeah, no, I absolutely agree with that. I absolutely agree with that. I think looking back at the school where I went, no, absolutely. I think you hit it right on. It's being it's being smart with the language that we use with the patients, right? And there was a few teachers that really highlighted that at the end of the program, that it's going back to the term soft skills, but truly you and I think that it's the hard skill. But yeah, no, it matters. It truly matters. And you know what? Even in my first year as an RMT right now, there was a few instances when I was treating in a clinical setting that I was like, okay, what do I say? Do I say less? Do I say more? And sometimes our patients and clients alike look for certain words,
Yeah.
whether it's words for comfort or you know what? I've had instances where people wanted more of an orthopedic pathoanatomical explanation to their pain. And I was like, how do I go about this? Right. So I try to be as general as possible. Right. But I'm a true believer that whatever we say, it's going to have a good impact to the person, or it could have a bad impact to that person's pain and well-being. So I personally think that will come with experience, and also some guidance with people that can teach that, right? Whether it's in the school setting or continuing education. That's one of the things that was, I would say, I've learned in the past year as an RMT.
Yeah.
How do I convey the message that I want to give, right? Depending on how that person is going to perceive it. So, yeah.
Yeah, that's so well said, Christian, and that's such an important thing for people, anyone that's listening, or anyone that will ever talk to you or me or anybody about this stuff, is that what we say, and sometimes not even what we say, but sometimes just what we do and how we interact with people is probably more powerful than anything we do with our hands per se in terms of treatment,
Right.
because you're interacting with a human, and if people don't realize the power of the narratives and stories we tell, then I think that's a huge opportunity missed in certain cases, if it's for positive, or it's a huge opportunity I guess wasted in the other way too, if it becomes a negative thing, because when we're looking at dealing with practice, and this is why I like to say it's called a practice for a reason, not a clinical perfect. You call it a clinical practice because you're always learning, and that's what you said too, right? You said that when people say things, you're like, what do I say? Like what's the person want, and how do I frame this in a way so it's not so I'm not making them feel worse, but how am I doing it so I'm not dismissing them? I want to validate their concerns, but I also don't want to give them this explanation, which I don't think is helpful. And that's the balancing act, and that's the thing that's so hard to learn, and something that all of us in practice, it's what's right and what's wrong. Really, I liked what you said, is it really depends on the person, right? That person that's there, what is it that they're looking for, right? If someone's looking for a very specific pathoanatomical explanation, and you try and talk more about lifestyle factors or other things that are going on in their life, and you can't find a definitive reason for their biomechanical type pain, and then you try and give them a different explanation, and maybe they just feel dismissed, and maybe they're like, "Oh, this guy is telling me it's all in my head," and that's not what you're saying, but that might be how they perceive it, right? And so I
Right.
really liked what you said there. You said how the person perceives what you're saying is really important. So I think that's
Right.
great. And it's good for you to be skeptical too. I love that. As a new therapist, you're already skeptical. It took me a long time to be skeptical, so I'm always happy. I'm like, oh, you're going to practice for a year, already skeptical? Oh, it took me almost a decade, probably, before I asked hard questions.
May I add something on to this same
You can say
topic
whatever
we're
you want,
talking
my
about?
friend. Yeah, go ahead.
Yeah, so I do work in two multidisciplinary clinics, and I love it. And one of the things I'm also very curious about whenever I'm working with my patients and clients alike is um, what their circle of care is like, and what type of messages the other clinicians are giving them, right? Whether it's a physiotherapist, whether it's a kinesiologist, whether it's a counselor or a chiropractor. I try to kind of reach that level of, okay, what are these other people are telling you, and how that might be affecting their perception of their pain, if I can say that. Uh, I know that sounds like a different topic, but that's one of the things that I've realized that, okay, like, you know what, this, your physio is telling you that this is it. How do you see that? What do you think about that? Right? Sometimes those are my follow-up questions, and I base it on that, and I find that every session, uh, we get to learn something new, hopefully at least with together, right? And I kind of just open up uh, another window of opportunity for the patients to learn something about what they're feeling, perhaps, right? And yeah, no, it's like you said, it's a very gray area, and it's absolutely not black and white. But I think with anything, it's a work in progress, right? I think that's another thing too that I like to also highlight is patient education, really, and learning with them, and really goes back to informed consent and seeing where they stand on certain decisions with their own care, right? And giving them the power that they've always had, really, to begin with. And sometimes they don't realize that, right? Some of the patients that have had this past year is, uh, they often blame their pain with some sort of tissue damage, um, aging factors, et cetera, et cetera. But as soon as we introduce the patient education side of things, more and more people are kind of understanding that it's so much more than what's affected, if there is really anything going on in a joint, a muscle, a tendon, et cetera, right?
Right. So and I love that aspect of patient education. I mean, that's, to me, is super important. And I think a good point to make though is that there's, if you go on social media, you read, like, there's a lot of people that think, if you're talking about like pain education or just patient education, they think you're giving them these like very specific like pain neuroscience explanations. And I always say that when we're talking about patient education, we're not talking about like pain splaining to people. We're talking about, educating
Right.
them about what's going on in them, based on what they tell us and questions we ask, and what information we can gather. But what you said, that when you give the people these, through this informed consent, through these discussions, and you're giving them education, do you find that it helps them to? Did you feel it has like an impact that helps them to function better, to get back to activities and things that are important to them?
Um, in some cases, yes,
Yeah.
and not all cases, right?
Yeah.
Um, Sometimes some of my patients just give me a blank stare, like, what
Yeah.
is this person talking about? And that's one of the things that I'm like, okay, maybe I should have said that better. And moving forward, okay, what can I do in that regard? But at the same time, I've had patients really realize the whole biopsychosocial kind of outlook on their pain, right? I bring up certain activities that they do in their daily living that's affected, or perhaps I might be the only person that they're seeing, and they think that I'm the one that does the healing, or I'm fixing something in their body, until I kind of get them into that thinking that what, maybe it's best if you can see a physiotherapist. Or what are your thoughts on starting active rehab? I really think that you would benefit from this, right?
Right.
Just like little steps that really are big steps, right? When I can get somebody um, moving, whether it's through my scope as a massage therapist, having a kin background and experience, but if I can get them seeing a physiotherapist, and the physiotherapist is very focused on biopsychosocial aspect as well, and they get them moving, or a kinesiologist, that I personally feel like I've accomplished something good for that patient. And some of them have returned to me and said, Christian, I'm really glad you opened that thought in my head, that what, I'm happy I started doing this and that, right? So yeah, that's at least what I experienced in the past year, and we'll see how it goes on moving forward.
Yeah, no, that's brilliant. Yeah, actually, there's something else I wanted to talk to you about too. Is that you've been practicing for a year. What is it like in the with the other clinicians that you interact with? Because you have a base of knowledge and you're interested in kind of some like current evidence based understandings. Do you find that the people you work with are at the same as you, or they know more? Or do you find they're more anatomically focused? What is your experience there?
Ooh. I think it's a mixed bag, to be honest with you. I feel like every clinician, whether it's a colleague in the massage therapy field, I feel like everyone's on this different boat, and some may take it on a more orthopedic level, but generally speaking, I feel that most of the clinicians that I've worked with are they know that it's more than what's going on. It's the bigger picture, right? Especially with chronic pain patients or population, from what I've experienced in the past year, right?
Yeah.
Having patients in that population, being a new massage therapist, the term imposter syndrome is hitting me hard like a truck, but I just have to keep a straight face and know that it's part of it's part of it. It's part of the process, right?
Yeah.
So absolutely. Hopefully that answered that question.
No, that's great. That's great. No, that's a great Christian, or a great comment there, Christian. And the imposter syndrome is huge. I mean, it happens to all of us, right? And even for myself and others that have been practicing for a long time, you kind of go to work sometimes and you feel like you don't know anything, right? Someone will come in into your clinic one day and you feel like, oh my God, like I know nothing. Like I don't know what the hell I'm doing. I'm a fraud. No, like, and even as someone myself who, make my living doing con ed stuff now too, sometimes I feel like, people are paying me to learn, or people are listening to this podcast, eventually, you start to feel like that imposter thing just is always there. I think it's probably healthy. I think if you're too cocky and you think you know it all, it comes across, people pick up on that, and it's a turn off for most people. So, if you're humble and you're aware of your knowledge and where your gaps are and the areas you know lots of and the areas you don't, I think as long as you're aware of that as a clinician, you're fine.
Right.
Even though it does hit you like a truck, it's sometimes you're like, hey, at least I know what I know and I know what I don't know. That's okay, because you can refer out, or you can recognize that this is something that is not, I'm not comfortable or confident, I guess, in this. So that's okay.
Yeah. And to add up on that, I've said that during certain treatments, that there would be a question that a patient would ask me that's super specific, and I've learned to be comfortable of saying I do not know, but we will figure it out together. And most of my patients have really appreciated that. I think being honest like that with your patients just build a certain level of rapport with them, and I think that's important to be honest as a clinician, as a massage therapist, when especially me being 1 year in, right? I when I they certain people, certain patients ask me a certain question that I wouldn't have an answer right on the spot, and you know what? I'm not giving you false answers. There's no way I'm doing that to you, right? To anyone, right? So I've had certain instances where I said I truly don't know, and I will do my work and look stuff up, and we can revisit this discussion. And if you find something, and if you're keen on looking it up together, then we can learn together. But yeah, no, very very humbling experience. This
Yeah. Yeah, it
first
is
year
pretty
market.
humbling when you get working with the public too, and you see all these different everybody that comes in, and everyone's so unique. But it's really important, I feel, and what you said there too, is to say I don't know. When you don't know, just say I don't know. And my experiences are, and other talking to other people too, is that if you say you don't know, patients will respect that. Rather than you just making something up just for the sake of trying to sound
Right,
smart. It's
exactly.
you want to be the hero. I think we all want to be the hero, but it's you know we also have to be humble and the term I always like, and I can't take credit for it, but wherever I got it from was we have to be comfortable sitting in uncertainty, and that's a really important thing to grasp that idea.
Right, right. No, I
Yeah,
totally agree.
yeah, yeah. So one of the things too is, like now that you have been practicing for a year, I was just curious, based on your entry level to practice and what you are now, what what are some gaps that you feel that could be better, like knowledge gaps that you think could be better filled, I guess, in the education. So we talked about, okay, ideal world, we'd want to have like a 4-year university degree. That's probably not going to happen. But in the current program, the current 2-year program, what other things would you think would be great to have those added into your program or into the program?
Um, as far as adding stuff into the program, I would say bringing in different guest speakers would be great, in my opinion. Maybe in the second half of the program, right? I know that the first half can be heavy on the academic side and just learning everything. But I think by term 5 or 6, so at the school where I went, there was a 6 term, and we had a lot of review courses, which was great. But I found that by term 5 or 6 would be a good time to start bringing in, introducing some people out there that possibly teach continuing ed like you know, and bringing in guest speakers that work in different types of clinics and stuff like that. So uh, also, I would say that maybe not adding certain courses, but just looking at a certain course and seeing if it truly fits the equation. If it should truly be part of the program per se. Um, there was a few courses that I took at the college that I went that I was like, okay, it's part of the curriculum, but in hindsight, I don't know if it should have been mandatory to be part of the program, right? I could have taken it outside if I wanted to, but I found that was my experience, and also possibly the way the courses are presented. I found that, let's discuss therapeutic exercise, for instance, right? So the clinic where the school that I went, it was in term 2, which I thought was great, but you know what? I can also see TheraX being taught in term 1. So when I was a student, we started student clinic in term 2, and I found that, you know what, if we could have done TheraX in term 1, it would have been a lot better in a sense, at least from my experience, right? Because I found, looking back at it now, there was a few people that I myself included, that I was like, okay, we're in student clinic, we have to give one hydro, one stretch, one strengthening exercises, one home care. But if we hadn't learned that piece yet, it doesn't really make sense to get us adding that in the clinical setting, if that makes sense. Just maybe some sort of a revision. And I'm only using Therex as an example, right?
Yeah.
That's where I find things can possibly revise in the program. So
Right.
little stuff like that. And the college where I went, they ask for feedback every other term, and even the teachers ask, you know, when after a course ends, they ask. They were really good at the college where I went, so uh, I I hope to have more guest speakers
Yeah.
like you and other people that teach continue ed courses to really get people thinking, right?
Yeah.
Instead of also, um, now that I'm an RMT, I see it at the BCRMT page on Facebook. People are just rushing to take a specific course, which like kind of goes back to that idea that I just need my credits to continue passing or continue working as RMT instead of like actively seeking specific courses that a clinician truly wants to do or truly wants to delve into, right? So that's at least my 2 cents on that.
Yeah. No, I love that. That's great. I mean, a lot of things that you said I loved. Yeah. So yeah, well, kind of one of the first things you said, yeah, being a guest speaker, I would love. I mean, I do that all the time. I love going into I love going into the schools, or usually it's over Zoom now. But I used to go to do like live ones in Victoria, like and then I've done them lots of them all across the country. Like talk to students, usually near the last couple terms, and as a guest speaker, and it's usually I just do it as a I usually introduce a little bit of skepticism. We have some conversations about stuff. Sometimes the instructors will have a few things that they want me to cover in more detail if it's something that's in my kind of my knowledge I'm comfortable with. I would love to do that. And so anybody listening, invite me to speak at your school. It's free of charge. Don't worry. I like to do it. It's fun. But I think that's a great idea though, because it is really, I feel there's so many RMTs out there that have a lot to offer and I really like that you said that it would be good to have people kind of speaking to schools, because what you're going to get, and this is my own bias here, is that when you don't have an agenda of trying to of anything to the schools other than just to give people information that might be different from what they've learned in school. And that's usually how I preface it. And I'm like, hey, if you want to talk to me more, you want to learn more, then just here's my contact information. You can reach out to me. But there's a lot of people that have lots to offer, and I think when you get somebody that's not in the school system but comes from outside, I think they have a lot to say that might get that brain thinking a little, like you said, get them to be a little more skeptical or critically think about something. That's really important. I also like too that you said about revising things, because we know that like rewriting the entire curriculum is not an easy process. But there is a couple courses I can imagine. The one I always think of that was just a waste of time was hydrotherapy. Like, why did we spend an entire semester in that course? Like, that made no sense to me at all. Why that was even a thing? Do they still? You said you guys still do a whole term of hydro? Is that correct?
Yeah, no. During my time at the college where I went, it was term one. Like I think it was, I don't know how many weeks long, but it was a lot of classes on hydro.
Yeah.
And yeah, no, that's probably something that the schools can look at and see whether or not they want to spend that much time teaching hydro, which is no,
Doesn't make any sense to me,
I
because you look at
totally
the
agree.
hydro. Like, okay, so first off, like when I was in school, we had to learn like a lot of spa stuff, like salt wraps and scrubs and things like that. That like no one ever does. I'm like, I don't know anyone that's ever done those. I've never even thought about doing them. And then you learn all the stuff on hot and cold. I'm like, why don't you just have a course like an afternoon? You sit down, you're like, hot and cold. Do you like it? Which one do you like? That's the one you use. If you don't like it, don't use that one. And if there's an acute inflammation there, okay, or if there's signs of different types of sensitivities, maybe you want to use cold versus hot, or if you're just looking for pain relief, like which do you like? There's a lot of research that supports that it doesn't really matter what the hell you do, but if you like it, that's the one to go for. There's very, very few instances where you wouldn't use one or the other. You could cover that in an afternoon. And it's so funny to me that they have a whole 8-10 courses on it, and you think there's so much better things you could do. I don't understand hydrotherapy, why it's a thing in schools, but that's get off my soapbox here. But anyway, that's great. One thing too, I guess, very, very curious about was, you obviously you have some ideas and some things you want to do. What are kind of some of the future directions you look at for your professional development? Like, it could be maybe, well, what kind of courses are you looking to take, as well as what kind of practice are you looking to have? Have you thought that far ahead yet?
All I wanted to do in my first year, I would say, is to get my feet wet, to see how it's like.
Yeah.
Moving forward, definitely I will have to make time for certain courses, certain continuing education. Like you said, the term evidence-based practice, it's such a loose term right now, and a lot of people are saying that term without truly understanding what that truly means. And I'd be lying to say if that was me. Like, that's absolutely me. Like, I was like, year one RMT practice there, and then year two moving forward. Okay, let's focus on doing that. So yeah, I mean, I'd love to take more courses and be part of a community that you have started and focus on that. And I would also like to learn some manual therapy stuff, but not delve into one specific modality, if that makes sense. Because I don't really, I'm not a believer that one modality is going to fix all, right? So, and that's me. I suppose that's me speaking as a new RMT, right? Just getting comfortable with touch and manual therapy, but not focusing on which modality I use, if that makes sense, or
Yeah.
not tuning into one modality. So I find that that's kind of a gap that I can work on. But yeah. And as
Yeah.
far as where I want to take my sorry, go ahead, Eric.
No. That's yeah. So I was just gonna. You can answer the next half of the question there. I think because there's a big question, but I think that's great that you said that, because this is such an important thing for people to understand, is that we shouldn't define ourselves by our modalities. We shouldn't just be like, my name's Christian and I am a insert your favorite acronym here type of therapist, right? You're like, no, my name's Christian, I'm an RMT and I help people with pain or athletics or whatever, cancer, whatever the populations that you want to serve. But we don't identify by a specific modality. And I love to hear you say that, because there's only so many different ways you can push, pull, and twist skin and move body parts. Like, it's a finite way. There's only so many ways you can stretch and pull and move, and but each modality that you take comes with its own story,
Right.
about how it's supposed to work. But if we really take the zoom out approach, we're like, it's all just different ways of touching somebody or moving a person. So how can one be right and one be wrong? Which one's right and which one's wrong? It doesn't really matter. It's whatever you like to do. So I always say to new RMTs, and this is why I wanted to have you on here, just to hear your perspective on all this stuff, which has been great, is, you're like, I don't want to identify with a specific modality. You're like, I just want, but it's useful to know different ways to touch people, right? So there's you take a course,
exactly,
and you can learn some new techniques. You're like, oh, I never thought about working on the shoulder that way, or I never thought about working on the hip that way, or whatever it might be. And that can be really, really useful. But it's the stories behind those modalities that's the problem, not the specific application of it in a lot of the cases. So that really makes me happy to hear that you're going to learn some different ways of touching people and interacting with them, but it's not going to define you, which is
no.
I just wanted to stop and I just wanted to stop and emphasize that there before you got on to the next thing. So yeah, the next part of the question was like your kind of professional development in terms of the type of clinician you want to be, or the type of practice you want to be in. Is it small, big? Do you have any aspirations for that?
I like where I'm at right now. I do truly enjoy working in a multidisciplinary clinic. I find that having that circle of care in for the patients that go to the same clinic helps. But also at the same time, what I'm realizing is, if I am not the best clinician that could be for that person. So to give you an example, somebody that comes in to the clinic and asks for a specific type of treatment, whether it's, let's say, lymphatic drainage. That's one of the things that I want to make sure that my professional identity, if I'm not comfortable doing it, or if I think that I'm not the best fit for that person, then being able to refer out to other RMTs for that. And I think as a new RMT, that's one of the things that I want to delve into. Just learning who's around me, the community RMTs that work around me, and see who I can refer out to, and just I think certain groups on Facebook are great at that. I know that the one that you have is great for that. But I think we need more of that moving forward for new or seasoned RMTs, to be
Yeah.
honest with you. But as far as how big I want my practice to be, I found that I did work a lot in my first year, and now I'm like, okay, I want to take my time, probably work the same hours, but I guess look into certain things and what I can better myself as a clinician.
Yeah.
But definitely not focusing on how many patients I'm treating and how many hours I'm doing, but maybe honing certain skills, whether it's the hands-on stuff and also just the what do you call that? Some of the courses that people like you teach, right?
Yeah.
Just getting out there and seeing what else is out there, right?
Yeah.
I think that's important. Um, I think with new RMTs that I've noticed, including myself, is we're so focused on just treating, and we've spent so much time, so many hours studying in the past 2 to 3 years, and now we're actually, whether we're excited to practice, and we tend to forget that continuing education and always focusing on our own mission and vision as an RMT, right? So
Yeah, that's amazing. That's amazing, Christian. And I really like that you said that, kind of just getting your feet wet and just kind of getting a feel for things, which is such a smart way to go. And I really envy that you've been able to kind of bring that into your first year of practice. You said you said a term earlier you called circle of care, like talking about people that come to see you and wondering who's in their circle of care. But I think also with what you're saying too is that you want to see who else is out there because you want to have a circle of care that you can refer out to for people, or you can know who else is out in your community. And if someone goes to such a clinic or they see such and such a person, you kind of have an expectation or an understanding of what that person's about, and maybe the kind of treatments that your clients saw or the type of messages they were given. And that's a really important thing too, to expand your community, and expand the people that are out there, that what they're all about, and how people can be helped by not just yourself but through others. And that's really important. And taking the time to recognize your knowledge gaps too is really key. I think that self-reflection is really such an important skill, to think, I need to know, I want to learn more about this. And then that's you can go and do some professional development to try and fill those gaps is really important. So yeah, I'm really happy to hear all this, Christian. I think you're going to be, it sounds like you're going to have a good, long, healthy career. You're already recognizing that you don't need to just keep working and plugging away by seeing as many people as possible, because that's a great way to burn out. I can guarantee that you will burn out, and
yeah,
you won't last long. Well, you might last long, but you probably won't be as productive or happy. So that's great to hear.
yeah.
You're young. You have lots of time to pay off your student loans.
That's right. That is
Yeah.
right.
Yeah. Yeah. It's easy though, right? When you finish school, you've spent all this time, all this money, you go out there and you're like, okay, now I got to pay off my debt and I got to build a practice. And, there's a lot of other extenuating circumstances that can influence how we practice. And, it's really good to hear your perspective. So, thanks for sharing that today.
Absolutely. Thank you, Eric.
Yeah.
What's your experience with new RMTs like me? Like, what is it like for you? Like, whether it's in a clinic that you work at, whether it's through continuing education, do you find that there's something that you're seeing with the new RMTs that are actually reaching out
I love this question so much.
to you?
Yeah. No, I love this question so much. So thanks for asking that. That wasn't scripted. If anyone's listening, or you just, it was a great question. This is okay. My personal experience, right? So people that tend to reach out to me are people that have listened to my other podcast, or have been on my website, or they've interacted with instructors that know who I am, or whatever it might be. I find personally that most new RMTs that I interact with are really quite amazing. They're skeptical. They have been introduced to certain kind of concepts and ideas that were totally foreign to my generation of RMTs. And I think it's great. And so I think the future, I'm really happy with the future of the profession, based on people like yourself and other new RMTs. they're trying to challenge the status quo. They're very self-reflective in their knowledge. They don't want to just sit back and accept that, the clinical massage therapy textbook that everyone has to use from the 90s is the only way forward, right? Like that's just not okay. And so and I hear that all the time from people. And so I'm really, really, really inspired by what I see with new RMTs in the courses I take, or my course I take, when the courses I take too, but the courses I teach, I also do find that the new RMTs, now it really depends on where they went to school. I do find that there's certain, I can usually tell within a couple hours what school the person might have went to based on how they are in the class and the kind of questions they're asking. People from your program, I find, are probably like near the top in terms of, oh yeah, I heard this in school. Oh yeah, this makes sense. Or, oh, can you have clarification for this? Whereas what I get from people from other schools, which I'm not going to name them either, they come into the courses and they're like, oh my God, I've never heard this before. What are you talking about? Like it's extremes, right? One group is getting, I'm going to say, more up-to-date education. One group is getting, here's the information you need to pass your board exams and we're not going to tell you anything else. And you do get that. But for the most part, most RMTs that I encounter, new ones, are really, really top notch. The problems I have found most in my CE journey over the years has been the older, more, I should say older, it sounds like I'm ageist, the more established RMT, the RMT that's been around for a long time, that everything that is coming out has been coming out for the last 5 to 10 years in terms of evidence or understanding that might be challenging what they always thought they knew. When those people that really hold on to those old ideas, those are the ones I find are the hardest to deal with, whether it's online or whether it's in courses or whether it's in conversations. And I think this is just totally my opinion, is that when you've been around for a long time, you people will tend to often really hold on to those ideals and they don't want to let go of them because they become to identify themselves by whether it's a modality or an intervention or a way of thinking. Whereas I find that new RMTs, they haven't had the time yet to really identify. They're still like yourself. They're like, I'm not really sure. Like they don't really hold on to their ideals too strongly. Whereas I think as time goes on, people really hold on to that, and that's when it becomes harder to change. I don't want to be ageist, but you can't you can't teach an old dog new tricks. It's kind of one of those sayings that I find is can be problematic. However, that is a generalization. I have met a ton of massage therapists over the years that have been practicing for a lot longer than me, and they're fantastic. And they'll say things like, "This is the stuff you're talking about, Eric. This is stuff we talked about 40 years ago or 30 years ago." But then we had to forget about it because we had to become more medical. And now we're coming back to this more, I don't know if I would use the term holistic, but more whole person, more full, like treat the human type thing. So it goes both ways. That was a long answer to your question. To summarize, new RMTs, I find most of them are fantastic. Most of them are very skeptical. They want to learn. They don't hold on too much to things. The more established therapists, it can go one of two ways. Some are very stuck in their beliefs. Some are like, yeah, this makes sense because this is what I've been seeing and doing for 30 years. So, yeah, it's interesting. It's never boring.
Yeah, no, it's a good thing.
Yeah. I always say that if I every single time I taught a course, if it was exactly the same, then I would be bored. So it's always different. So, there you go.
There you go. No, I really appreciate that answer. No, it's also nice to kind of see what your experience is like, hearing from from my end. So no, I think you did that on. Yeah, I think I agree with that. That newer RMTs, we in theory we should be our identity is not quite molded yet, so now is the time to be like, okay, let's learn, right?
Yeah.
So yeah, no, thank you for that answer.
Yeah. No, you're welcome. That was a great question. I love that. And that's a great point too. You said molding your identity, because one of the things that I heard a number of years ago, which really I've held on to, is that never hold too strongly to your ideals, because your ideals can change with science. And that's really important too. I know when I took a deep dive into the pain science stuff, that was probably about 2013, 14 when I first started kind of digging into that world and trying to make sense of all that stuff. And then now, even over the last 7 or 8 years, 9 years, I guess, it's getting into the way I think and the way I understand things is very different, because you're constantly skeptical of everything you learn. And if your ideals are like, I want to be evidence-based, I want to be less wrong every day, or every time I take a course, or every paper or book I read, I want to learn more knowledge, and I want to challenge myself, I want to challenge my biases and my beliefs, that is how we are going to grow. I think if we focus too much and we're like, I know everything and I'm this type of therapist and I don't want to, and this is my identity, and we don't want to change, that's when we become stuck. And that's when we stop growing. And
right.
So even though you said molding your identity, I would say your identity, unsolicited advice here, any new RMTs listening, yourself included, is just, you're going to form an identity of how you think and how you like to practice, and that's totally fine. But just keep that very malleable, so it's always changing based on new information, because otherwise we can become stuck, and then we're not serving the public's interests to our best.
I totally agree. And to add on the similar note, I think one of the times I first listened to your podcast, I forget which one it was, but the fact that people like you in this profession are elevating the bar and raising the bar, in my opinion, because I think that even for myself, I still like to learn stuff from different clinicians. So from like physiotherapists that work in the same clinic where I work, but it's always so nice to learn from RMTs themselves. It's still a separate profession, different scope of practice. I totally agree that we can learn a lot from physios and other clinicians, but at the same time, to build that foundation and that community within, I think just makes more sense, to be completely honest with you, right?
Yeah, I agree with you 100%.
Yeah, I think it's great, the stuff that you're doing, and I really thank you for that. I know I haven't met you in person, but having this opportunity to me was great. So
thank you.
To explain my experience, and I hope, I'm truly excited about hearing other new RMTs possibly speak to you, and hopefully they can share their experience and hear what they're up to, and their gaps, and their overall experience as new RMTs. I would love to hear from others, right?
Yeah. Oh, great. Well, I appreciate that, Christian. I appreciate you taking the time to be here. I'm looking forward to hearing more. I mean, I've got a bunch. I've done a few already, and I got a bunch more lined up of new students, and I'm trying to get them trying to get some from across Canada. So it's not just here, but just try and get some knowledge or some stories from them to hear their experiences. And I think it's important to see how people experience their education, and where they see things are going well, where they see things where there's gaps, and where people want to go, because like you said too, and what I've said all the time is I really want RMTs to realize our potential, to get to a point where we are not looking outward to all these other professions, recognizing that they're there, but we can start building up from within. And I think a lot of that comes from, like building community, but also building other CE instructors, but also, getting good instructors in the massage schools. And if we don't have these conversations, and if we don't hear people's experiences, then we're not going to know what we're doing well. And even more importantly, we're not going to know what we're doing not well.
Right.
Yeah. So I think it's important to have these conversations. So I appreciate you being here today, Christian. That was really great. I really enjoyed our conversation, and all the best to you. And if you're ever here on the island, send me a message, and I'd love to get together and meet you in person.
Will do, good sir. Thank you. I appreciate it, Eric. This was great.
Thank you. Have a good day.
Thank you. You too.
Thank you for listening. Please subscribe so you can be notified of future episodes. Purves Versus is available on all major podcast directories, and you can watch each episode on YouTube. If you enjoyed this episode, please like, subscribe, and share to your favorite social media platforms. If you'd like to connect with me, I can be reached through my website, ericpurves.com, or send me a DM through either Facebook or Instagram at ericpurvesrmt.